right. Welcome, everybody. Let's make sure I'm picking the right screen, right? All right. And Larry, we're going to go ahead and start with you.
Okay, I am very excited to welcome all of you to our final 2025 Community Partners meeting. We so appreciate your taking your valuable time out of your day to be with us today, which has an action packed agenda. And it was great to see everyone in person last time, but given the snow and the cold, we're happy to be virtual today. So thank you all very much for coming. And it is my honor and pleasure right now to introduce our wonderful Waukesha County Executive, Paul Farrow. And I had the privilege of hearing Paul speak this morning at Mayor Riley's Celebrate Waukesha breakfast. And the one thing that stuck out to me is Paul is celebrating his 10th year as our county executive. And he shared a chart with the large number of people showing, and I think very few people know this, that the Waukesha County tax rate over the last 10 years has gone down every year. Now you're thinking, why aren't my taxes lower? That's because the county is only one part of the piece of the puzzle. But for most people in Waukesha County, the value of your home has increased while the tax rate has gone down. And the person who creates the initial budget that the county board recently passed is our county executive, Paul Farrow. And we are thrilled to have him with us today. Is this your last speech of the day, Paul, or is there another one coming up?
No, it is the last one for today. So good news.
Okay. So let's all give a warm virtual welcome to County Executive Paul Farrow. I learned this is how to applaud when I saw a deaf actor at American Players Theater. So, Paul, take it away.
Well, thanks, Larry. I appreciate it. And welcome, everyone. Thanks for all that you do. I think you're going to hear me on repeat on a lot of things. But I'm going to kick off. We were just joking about it as we're trying to stay warm. And Larry's saying, it's nice to stay hunkered down. We don't have to get out in the cold. Well, my warming system just left me. My golden retriever just left from underneath the desk here. My feet were nice and toasty warm. He decided to go for a walk with mom. And so now my feet are getting cold. I'm going to have to work on that. It's always helped with the neuropathy in my feet to have him lay on them. It's been fantastic. Give you a quick update on myself as I've done the last couple of times. Most of you know, unfortunately, that C word is back. So I'm facing a couple of challenges. I'm going to be working with a new oncologist to look at some immunotherapy ideas and some things that are going on out there. We've got it early in the detection, so it's just a small area that we're going to be aggressive on. As I try to continue to get my strength back, that was kind of a setback for me, but it's not going to slow me down from what we're doing. And a lot of what we do is working with individuals like yourselves to make Waukesha County better in so many different aspects. This morning I kind of jokingly started off with the good news was we have an incredible Department of Public Works team here in the county and the municipalities that handled the snowfall on Saturday, I think, incredibly well. When you look at the numbers, as I checked with my dispatch team, fortunately, knock on wood, we only had about 28 accidents that had an injury related to them. We had people in the ditch, we had other things that went on that are common, but the amount of calls, when they looked back, said it wasn't an exorbitant amount of calls. It was typical for that type of situation for the storm. So I think people heeded the warning, made sure they stayed home when they could, kept off the streets, and our teams were able to keep up. So that's great. When we look at public safety, there are so many different ways we can evaluate it. not only through law enforcement and through our health and human services and through our court systems, but even the public works when they're out there making sure the roads are safe for us to get through. Wanted to give you a quick update as we're looking at kind of the big picture of what's going on in the county. Most of you know we go through the CHIP program every number of years that really sets the priorities for how Health and Human Services is going to respond and what areas we're going to be working through. What we also do in the county is a strategic plan every 3 years. And so we're wrapping up our last strategic plan. We're stepping up into a new one starting in 26. And this last one, we made opioids as one of the primary tenets in our strategic plan as we were moving forward and how we could deal with that. I think we've done a phenomenal job when you see things that are occurring. For me, it's one where I kind of smile and says, well, we've been doing that for X number of years. Or no, we've already got an organization that's helping out. One that I really kind of enjoyed recently was there's some ads. I don't know if you've seen them on TV. There's a couple who unfortunately lost their son to an overdose, fentanyl related, one pill, and they're trying to change state law to get, for lack of a better term, the oak boxes into schools. Well, I reached out to John Kettler the first time that I saw that ad and said, John, I thought we were already in the schools. And he responded, says, yeah, Paul, we're in the schools plus hundreds of other locations. So we didn't need the state to create a new law. We didn't need government to say, you shall do this. We went out and told the people the best way we can help our citizens and work together is to create this network. And I think when you look at what we have created through the incredible work with Health and Human Services and the opioid map that we have on our internet and our web page, we're doing what everybody else should be doing. We're leading the way. And I am grateful for all of the hard work that all of you have done to do that and help us with it. That being said, I'm looking ahead for the next 3 years. And one of the things that I do as a county executive is we set the kind of the primary goals of our strategic plan for the next 3 years to look at. And I will tell you right now, barring some major change, one of the primary tenets that we're going to be looking at is mental health and how we can respond in different ways. We've already doing some really good things, but it's how do we replicate and duplicate what we did, especially with opioid awareness and opioid education, and bring that over to the mental health world as well. And give, Liz and I were talking just the other day, give families and parents the tools to say, here's what you got to be watching out for. Here's how you can have the conversations to get started. Now, this is where I get myself in trouble because I'm going to throw ideas out there. You guys are going to all say, this is great. I am nowhere near getting any of this ready to go. This is just me having fun. As Terry knows, my ADD goes into a hyperdrive when I come up with new ideas. But I would love to create a crisis intervention training program like we have for law enforcement and our EMS for parents, for individuals who are out there in the community saying, how do we respond to a situation? What should we be looking for that could help us get somebody the help they need as we move forward? And I think about all the impacts that we have seen through what we've done the last couple of years, actually, I would say almost 5-6 years now, dealing with opioids, dealing with the drug overdoses and fentanyl issues, bringing that energy now over to mental health, which isn't a huge reach. As you all know, they go so much in hand in the challenges that we have. But if we bring that energy, what can we do to make a difference and how can we make that change in Waukesha County? And I think it's going to be dramatic. So I'm excited to get that ball rolling. I apologize that I can't stay on the call full time. I'm actually in about 15 minutes getting on a conference call with my 2 oncologists to figure out what our next steps are there. But I just want to say thank you all again for the hard work that you put in every single day to help make a difference in the lives of individuals that here in Waukesha County and throughout the municipalities as well. Really appreciate it. I hope you guys take a time up, especially during the holidays, to take a deep breath, relax, recharge, re-energize. Terry, as we said, go out and watch the snowfall. Don't think about shoveling. Just look at the beauty of nature in itself and enjoy it. And hopefully my golden retriever will be back here warming up my feet in a few minutes and enjoying that. But everybody really enjoy your holidays. Have fun with your family. take some time to take a deep breath and be ready for 26. Thanks, everyone.
Thanks for being here.
Hey, Paul, I just want to say they say the best thing for your mental health and physical health is to stay actively engaged. So you are a wonderful role model for all of us to keep your sense of humor, stay actively engaged, and we so appreciate it. And I also want to acknowledge three of my fellow supervisors who are with us today: Christine Howard, Wayne Euclid, and John Gescheidmeyer. I want to thank you all for being here with us. And with that, Terry, I'll turn it back to you.
Oh, thanks, Larry. I'm gonna grab my slides again. Um, we did this at the last meeting where we recognized, and we can see my slides, right? Yes? Okay, great. We recognized some new folks that aren't necessarily new, but they've joined our email list and they are here today. So we wanted to welcome Leslie and Anjali, Ashley, who I worked with on a dementia project 10 years ago. So it's good to see you. And Deborah, thank you so much for being here. So we appreciate it. And there may be some others, but those were the ones I pulled out of the list that I recognized as new. So welcome to joining us today. And we had Paul ready. Quickly, the agenda, we're going to start with some important Heroin Task Force updates. We're going to do a little bit of speed networking. We've got a fabulous presentation from the a joint partnership between the Medical College of Wisconsin and Public Health. We've got some new trainings and workshops to share with you. We've got some action team updates, and then we'll talk a little bit about what happens next year. So that's what's on the docket today. But before we do that, we wanted to take just a second to thank our leadership. We have many people sitting on the steering committee, but these folks that are on the screen right as you're looking at it right now are folks who stepped into a leadership position on our action teams. And we wanted to just recognize this is not easy work. Collaborative work is hard. It's a heavy lift. The outcomes are phenomenal, but they don't always go in a straight line. And there's sometimes a little zigging and zagging and some heavy lifting. So we wanted to say thank you to these folks. So thank you, thank you, thank you. And I work with them all the time. So I am so grateful for your leadership. The second thing I did, on that snowy day, what else do? You go and start looking at data. And I started just kind of going back and pulling out a few numbers that I wanted to share with you guys today. We've got about 275 folks on our email distribution list, and it hovers around that. We haven't hit the 300 mark yet, but it hovers around that with people coming and going. We've got up to now 348 followers on LinkedIn, which is really exciting. If you haven't joined our LinkedIn page, Jamie, maybe you can drop it in the chat for us, Jamie Bauer. We've got 60 different individuals actively engaged in our action teams. So I went through and did my little sorting and what have you with my Excel spreadsheets. And out of those 60, 37 individual organizations are actively engaged. So everybody's got a role to play. And at some point, I'll share with you a collaborative wheels of involvement diagram. But some people are super, super engaged. Some people want to just keep on that email list, and that is perfect too. And a lot of times we see people coming and going based on, what's happening in their world. So I just wanted to thank all of you who have been so involved. So this is really exciting. And again, this must have been the snow the other day, but if you can just grab your phone and hold it up to this QR code, I'd love to have you share one word that reflects the value that our action teams have brought to our community this year. Just a word of gratitude, a word of thanks, maybe some impact that you've seen. So we're just going to take a second here and fill a little thank you cloud for our folks, and reflective. And you can actually add more than one word. I've allowed it. So if you have another word, throw it in there. So we'll give a second here. connection, data, compassion, just like typical word clouds. So if the word is mentioned more than once, it's going to stand out a little bit. Partnership, collaboration, hope. These are beautiful. We'll keep them coming for a couple more minutes. Solutions. Harm reduction. Love this. Oh, Jamie, thank you. So she popped in the post that was most recent. I think that was just the other day. It was a great post. If you aren't on our LinkedIn, please join us. And it would be wonderful if you can repost as well as react to those posts. That's helpful for us too. Oh, these are beautiful. Thank you. So thank you, folks, for all of you who have been so actively involved, and many of you are on this call today. I'll leave this up for just a second, and I'll pop this in the slides when I do a recap. Well, all right, I think that's the next slide. Yep. All right, Kat, you are on my list next. Kat Becker from the
Amazing.
Alliance for Wisconsin Youth.
Perfect. Well, thank you, Terry. Is it possible for me to share my screen as well?
Absolutely.
Oh,
I am
let's
so
do it, you
sorry.
guys.
Yes, and you have
Um,
authority. Go for it,
oh,
girl.
I love it. I'm Kat Becker. I use she, her pronouns. I was at your last meeting. So I'll give a recap of what we do with the Alliance for Wisconsin Youth. We are funded through the State Department of Health Services as a training and technical assistance provider for coalitions like yours. So I support the southeastern region, Milwaukee, and 7 surrounding counties. And we have about 16 member coalitions like the Heroin Task Force in our region and over 100 statewide. And so we know that coalition work and the coalition structure is super helpful for achieving positive community health outcomes because our challenges are multidisciplinary. They cross sectors, right? And so we also have to respond in that same cross-cutting way. So typically, I mean, when Terry emailed me like, "Do you have anything? Do you want to be on the agenda?" I said, "I don't know. We'll see." And luckily for you all, we got our funding announcement from the state for our state opioid response funding opportunity. So I'm sharing my screen right now in the hopes you can see this. Can you see what I'm sharing? It's a PDF. No? Yes? Oh, I can't hear you, Terry, if you're talking to me. We're
Yes.
good? Okay, perfect.
Sorry.
No worries. And maybe you've seen this before if you have been like on our mailing list and stuff. And I warn you, this is a long document with terrible margins, but these strategies are what is allowable for funding under this state opioid response grant. And I'll show you up at the top here. There's some more clarifying guidance. And I will send this out, so don't feel like you're trying to capture this in your head immediately. But this is the funding packet that we sent out to all of our member coalitions literally this morning. It's hot off the press. And this is a funding opportunity open to all of our member coalitions. It seeks to support your opioid and stimulant prevention and harm reduction efforts. One thing to note, you will not see the words harm reduction anywhere throughout this application
Mhm.
packet. That is to play nice with the government. Certainly not my choice, but you'll see the words opioid overdose prevention kind of in that placeholder for harm reduction. And so these are your like allowable strategies on here. And I want to note that each coalition is able to apply for up to $18,000 in funding under these strategies. When you think about grant funding, you're maybe thinking like, oh, I'm going to be on calls with a project officer. I need to create a really competitive application. This is not that. We are given, I want to say it's near like $300,000 that we then chop up across our 16 coalitions and say, okay, $18,000 per coalition should all our coalitions apply. All of our coalitions never apply, right? Usually we get somewhere between like 10 and 12 applications. And so I just want to make you aware of this, that your coalition is up to apply for this if you so choose. And I think there are some ways that you could certainly build this in for things that you're already doing. I also want to note that this is a funding cycle that started October 1st. We didn't get our contract until yesterday. So now that that is signed and ready, we're able to like really push out this funding announcement and open the applications. Obviously, there is no ideal timeline on this. Of course, it should have been in our inbox and able to be sent out on October 1st. But we will take what we can get, especially these days. So this application will be open till January 9th. Obviously, there are some weeks in between now and then that people will probably not be in the office or otherwise not working, but we are just kind of on that timeline. So this document, and I'll share it in the chat, I'll send it to Terry so it can go out in emails as well, gives you this first page gives you kind of the overview of like what's the scope of the work that's allowable under this funding. And then it will break down further into some pretty detailed explanations of like how you can do this, right? I'm not going to scroll and give you screen whiplash on here, but I do encourage you to take a look at these. And I don't know how the best way to do this maybe is given the shorter timeline, but I wanted to make sure that you're all aware of this as you are one of our very robust and effective member coalitions. So,
Kat, thank you. Are you
yes.
are you planning to host a grant, like like a grant thing where we can ask questions and things like
Yeah,
that, or
not like a specific kind of like open office hours for this one, just because of the scheduling with holidays
okay.
and stuff.
Okay,
But you can certainly shoot me an email and say, I need an hour to talk through this, and we can brainstorm it.
perfect.
That's again
Perfect.
kind of one of those benefits that we can provide because this is not a super like competitive funding source, is like
Perfect.
I'm in it with you to help build a strong application if that is useful, you know? So
Great.
I think perhaps one pathway to think about this is having folks identify in this funding announcement work that you're already doing or work that has been done between October 1 and now that you can backdate and get reimbursed for as long as it falls under these allowable activities. So there's one I would call out too, that school-based prevention programs is kind of like it's like the cousin that we just lump into this funding. We get a big bucket of funds to do or to support people doing evidence-based school-based prevention programs in schools or a schools like setting. So if you're implementing Botvin life skills or Too Good for Drugs or an evidence-based curriculum, we can help support the purchase of materials, the payment for staff time, training instructors, etc. And all of those details are further down in this document. So
Great.
that's my big item. I can tell you also we don't often get wins in this work, at least publicly, but something we included in our newsletter. And I don't know if there were any drug take back events in Waukesha County this fall, but Wisconsin yet again for the sixth year in a row has knocked out the entire country as number one in collecting unused and unwanted medications. And so that's something that we can also fund those events under
Awesome.
this funding. So I'll share all
Awesome.
that. Happy to answer any
Perfect.
questions. But those are my main updates today.
Kat, thank you. We really appreciate you attending, and we'll get this out to everybody. We have a steering committee meeting tomorrow, and I'm going to put that on the
Perfect.
agenda, so it's
Love
perfect.
it. Awesome.
Great. Thanks so much.
Thank you.
Wonderful. All right. And at this point, we are going to head on to, I'm really, really excited to bring Frances Thomas and Felicia Benkeshaw forward. They're going to share with us an update on the Voices survey. It is now launching, so this is really exciting. We've been at this for a while, and Frances, I am going to actually stop sharing so you can start sharing. We are going to put some information in the chat with the documents that Frances is going to, and Felicia are going to be referring to. We will also send it in our follow-up information. So take it away, Frances and Felicia.
Perfect. Thanks everyone. We're going to be talking about the Voices survey today, so I'll hand it over to Felicia to start.
Thank you, everyone. We're so excited to finally launch the Adapted Voices Survey here in Waukesha County. Frances and I and the data and metrics team have been working on this survey since 2023, and we're so excited to launch it. So this is what we hope to cover today. We're going to talk about what the Voices Survey is, who and how people can participate, and how you, your local organization and agency can help us. So the Voices is a large study that is confidential, and it's focused on listening directly to the people who are using substances. We're gathering lived experience, to understand substance use patterns, overdose experiences, harm reduction awareness, and access to treatment and recovery. The goal is simple: to use real voices to improve real services. So this survey was originally conducted with a partnership of Johns Hopkins, Vital Strategies, and the Pacific Institute of Research and Evaluation. It was launched in 3 states: Wisconsin, New Jersey, and Michigan. And Francis and I were introduced to this survey through Vital Strategies. We're super excited that we're going to be able to replicate it here. The survey was also, Johns Hopkins published it in JAMA. There was a total of 1,240 participants throughout all 3 of the states, and the link is available to read the paper in our presentation, and I think it's going to be dropped in the chat as well. So it was replicated in Milwaukee, was the city in our state, and they had 498 participants. This is one of the largest studies done in our state that utilized people with real life experience that were actively using substances. When this survey was conducted, the eligibility requirement was opioid and stimulant use, and that they had used a substance within the last 30 days. We've adapted our survey to extend the eligibility requirement. So we are looking for individuals who have actively used a substance, opioids or stimulants, within the last 30 days to the last year. We also added questions related to long-lasting injectable buprenorphine products such as Sublocade and Brixadi, and we added questions also about xylazine test strips. Otherwise, we've kept the integrity, reliability, and validity of the survey completely the same that Johns Hopkins has written it. So we also created a website with the help of our awesome friend, Lisa. So we launched the waukeshacounty.gov/voices website, and that link is also available live for anyone to check it out. It will cover a lot of the information that Francis and I discuss today and share with you.
Okay, so we wanted to go through kind of what the Voices survey was, how it came to be, and just sort of like lay the groundwork that it's legit survey, right? Like you can trust this. It came from a really trustworthy source, being the Johns Hopkins School of Public Health. So now I'm going to get into a little bit about who can participate and how our partner organizations can be involved. So in order to participate in this survey, an individual needs to be 18 years or older, have used cocaine, crack, methamphetamines, or opioids within the last year, and live or spend most of their time in Waukesha County. Just to reiterate, this survey is anonymous. So how does someone participate? This is a phone-based survey, and we're lucky enough to partner with a local nonprofit, Beyond Vision, to be our call bank, our call center bank for this survey. So if someone thinks that they meet the participation guidelines, they would call the Beyond Vision number anytime between now and January 31st, between 8 a.m. and 7 p.m., with the exception of a few holidays, and complete the survey. We're anticipating it will take about 30 minutes. There's a very slight chance that the phone line would be busy, and the message system will just record their number and call them back as soon as an operator is available. And by setting it up that way, we saved a lot of money. So we wanted to be, economically friendly with this survey and make sure we are using our resources appropriately. So it is open now. It's also available in English and Spanish. If someone successfully completes the survey, they will receive a $25 PEX Visa gift card, and that will be loaded within 72 hours of survey completion, most likely a little earlier, but we would rather under promise and over promise on our when the card will be loaded. So how can you be involved? So you could help us recruit by handing out potential participant packets, which I'll show I have a video of in the next slide. You can help explain the survey to potential participants and stakeholders. You can hang up a flyer at an organization like the one you see in the slide. If you serve clients who might meet these participation guidelines and you want to like hang up and advertise, we can give you a version of this flyer that fits your organization best. And we're not going to take it to social media yet. We want to really partner with our local organizations first, but if we need a boost in survey respondents, we might move this to social media, and then we would really appreciate your help in sharing that message forward. So participants are going to receive what we call our potential participant packet or our participant guidebook. We have about half of them made so far, but it will actually come with the gift card in it. So it comes with an unloaded gift card. What this helps us do is make this survey completely anonymous because we don't need to collect any of your personal information to have this. So we will come if you want to help us get participants. We'll drop off some packets of paper like this to your organization and you can help us hand it out. It basically has everything about the survey in this packet, including who can take it, how it works, what number you call, and then the PEC's information about how your card works as well on the back. So it's really all encompassing, and we're hoping really easy to give to partners to hand out to potential participants. So what will we do with the results? We are partnering with Marquette University to do the analysis and help us create a final report that will be created and shared with community partners. For example, this group would be a wonderful place to do that presentation, as well as our CHIP group and other community organizations. All of the data and analysis will be shared in an aggregate form, so no individual or personal information will be shared. It will all be de-identified. And we don't even collect HIPAA information to begin with. So the timeline, as Felicia mentioned earlier, we started this journey way back in the fall of 2023, where we learned about this survey. In 2024 and 2025, we developed the survey and secured funding and did contracts, a surprisingly difficult process. In November and December, we're working to recruit community partners. And then our survey will be open for 2 months in December and January. We're hoping to have the results published in May, which would then allow us to present our results in June of 2025. Of course, anything can happen, so this is our preferred and ideal timeline, but what we're looking at right now. Some questions we thought you might have. Can someone who doesn't live in Waukesha County participate? It's a yes and no. So yes, there is no formal geography requirement. We prefer that Waukesha County residents are the primary target. Broadly, the survey is advertised to people who live or spend most of their time in Waukesha County. So in the survey, we'll ask you for your zip code. If we start noticing most of the zip codes or a lot of them are not Waukesha County zip codes, we might change how we're advertising this. So we know that there is not some line that prevents people from getting treatment or being in Milwaukee County or Ozaukee or Washington or Jefferson County versus Waukesha. So we understand that we don't want to just limit it to Waukesha County. We know that there's fluidity, but we want to make sure that the largest number of participants are from Waukesha County. And then can someone take the survey without a physical gift card? Yes. So our primary way to advertise is through these participant packets, which has a physical gift card. If someone loses that gift card or they never had one to begin with, or you think someone would be perfect, but they're not going to come into your organization or our organization to get the gift card, there is a virtual gift card option, and the person would just tell the interviewer at the beginning of the survey. The surveyor will ask, like, do you have a physical gift card? The caveat with that is if you don't have a physical gift card, you will need to give that person some contact information because they need to basically be able to give that virtual gift card back to you. So on their end, they'll activate it through the PEC's website and then send it back to you. Your name would never be associated with your survey results, but it does give away a little bit of that anonymity that might encourage someone to take this survey. So, yes, they can take it. And if we go the social media route, like we're really needing people to participate, we might advertise the virtual gift cards more. But right now it's just sort of an option if you don't have a physical gift card. So, who's in? And at this time, we're willing to take any questions.
Thank you, guys. Awesome presentation. So questions for Felicia and Francis. Nicole Kelly dropped in the website. I apologize. I forgot to put that in that little chat. So she's got that up there. We'll send out the information. It's also in that Google Drive. So let's see. Angela says it's wonderful, Francis and Felicia. Any questions of clarifying questions for Francis and Felicia about the process?
Or anyone who's in and wants us to bring you packets. We can bring them ASAP. I have hundreds ready.
Drop it in the chat and you guys can do the coordination. All right.
Do y'all, I know that we talked about this a little bit on the informational meeting you had last week, but I'm getting like positive feedback just from like word of mouth with my boss right now. Would you be open to like maybe meeting with like me, my boss, and possibly the owner of Wishope? I just want to make sure that I'm not leaving out any of the information that you guys have worked so hard to put together. And you do such a good presentation too. Like, I'm doing okay with selling it, but like I feel like you guys would just like take it up a level. So if you'd be open to that, I'd love to set up something with Wishope.
Yes.
Absolutely.
Awesome.
Can you just drop your email in the chat and I'll send you an email with some available times of me and Felicia and we can set something up?
Yeah, definitely.
Awesome.
Perfect.
And Francis, Susie said you can drop some at WCS too.
Awesome.
All right.
Thank
Then we
you,
will
Susie.
keep moving along here and just keep that chat going. That's wonderful. That's perfect.
And I sent Terry all of the information as well as like the participant guidebook and stuff. So she'll be able to forward that to the whole group. So you'll be able to see as well as our slides from today.
Yep. And it's in that Google folder that we just put out,
nice.
but I will follow it up with an email too. So it goes to the full task force. Francis,
Thank you.
Felicia, awesome. And as they mentioned, we're hoping in June to be able to have them present and us to kind of digest that data a little bit and talk about what does that mean for for the work we're doing? How does that change some of the strategies that we are working on? So thank you guys so much for that. All right, so now we're going to do we had a lot of talking at you, and now we're going to have a moment to talk together. We are going to put you in breakout rooms for about, 8 minutes, I think is what I said, right, Rachel? 8 minutes, yep. And what we'd like you to do is in the breakout room, introduce yourselves, tell each other who you are. And the questions that we want you to ponder together is what's something you're currently working on that you're excited about? And how might our partners engage and support you? So we're going to give you about 8 minutes. Just take your hand off your wheel of your mouse and your keyboard, and Rachel has the room set up and you will automatically be put into the breakout rooms. Any questions before we do that? Awesome. All right, let's do it, Rachel.
it kicked me back here. Maybe it was my fault. I'll be
You
honest.
know, it's always there's always one or two cat that just have a little trouble getting to where they need to go. So let's see.
Yeah, if you can click on breakout rooms and click join, that'll help.
Awesome. Anjali, were you kicked out of your room too, or
She's on mute.
oh, you're on mute.
I was
I'm
kicked out
sorry.
of the
Yeah, I
meeting.
was with Veronica King. I'm not sure what happened.
So if you'll go to the bottom of your screen where it says breakout rooms and click join, it should allow you to go back in.
Bottom of my
Yep,
screen.
at the very bottom. You might have to hit dot dot dot.
Yeah, I was going to say more.
Yep. And then join breakout room.
Here we are. Okay, thank you.
You got it. Wayne, are you having trouble? Or Cassie? Okay, Wayne's in. Cassie, you good? She might be away.
Yes, not join. Oh no.
Oh no, Anjali. What is happening?
Let me see if I can make a new room.
Okay, that sounds good. I can go in with Anjali too. Oh, there she
It
goes.
pops up a dialogue and then it says leave session or you got it. And I hit got it, which I thought would put me back in, and it just kicks me out then.
Never seen it. Got it.
I'll try moving you to a different room.
Yep, there we go. Sorry, Wayne.
Can you try joining now?
All right, that'll work. Okay, I am pausing. We got it. Thank you, Rachel.
All right. Hello, everybody. My name is Jamie Penza. Stephanie Engel and I are co-leads for the Waukesha County CHIP Substance Use and Housing Group, and we're presenting today with our community partner and project collaborator, Haley Nanonen. Today's presentation was adapted from our breakout session at the 2025 Waukesha County Partnership Summit, and it's called Choose Your Own Adventure, Advancing Partnerships at the Intersection of Substance Use and Housing. Our presentation will go over the path that our CHIP team took as we embarked on our quest to build an evidence-based, systems-level transformation product that could be used by multiple disciplines to make real changes for real people. Today, the three of us will walk you through our areas of expertise and research as we take a look at where we started, where we are now, and how we could use your help to take the next steps. But before we get into the data, I just want to thank you so much for inviting us to share our work with the Waukesha County Heroin Task Force and for your commitment to strengthening community health through collaboration, data-driven strategies, and bold community-led action. Next, I'm going to pass it over to Stephanie Engel to get us started.
Thank you, Jamie. Thanks everyone for the opportunity. I'm not going to go deeply into my bio here because I want to get into talking about the brilliance of Haley and Jamie. So just for the purposes of this moment, I'm going to describe the interwoven nature of the Overdose Fatality Review Program and how that intersects with the current CHIP cycle. If people haven't unpacked the acronym CHIP, it stands for Community Health Improvement Plan. It's on a 5-year cycle currently, and we are going into year 5 actually in 2026. My role, I'm a public health social worker. I'm responsible for the design and coordination of the Waukesha County Overdose Fatality Review. That team that I help to coordinate is essentially a multidisciplinary team that's intentionally comprised of a wide range of sectors and disciplines, where we really value also people with lived and living experience. They're seen as both pivotal and valuable to our work and the outcomes that we hope to generate. Our North Star for the overdose fatality review is to reduce and prevent substance-related deaths in our community. And we do so by reviewing substance-related deaths and identifying missed opportunities and systems gaps to become a more prevention-oriented community. Jamie, if you could advance the slide, please. So in August of 2022, this is probably information that people are well aware of, but I just want to set the context here. County Executive Paul Farrow declared fentanyl a community health crisis. And a directive of that health crisis was to establish a Waukesha County overdose fatality reviews. And the purpose behind that is to really acknowledge the urgency and importance of mobilizing together as a community to address the opioid crisis. Next slide, please. So this is a decades-long opioid crisis we're talking about. And what I want to just analogize today with this famous iceberg graphic that probably most of us have seen if you're looking at the sort of the right side of the frame there. Reported deaths are often the focal point of our dialogue that we talk about. This is often what we see. It's often what we acknowledge that's above the water level. Today, I just want to address what is really hidden or unseen and unacknowledged is the grief and trauma and socioeconomic impact that people are carrying around in their everyday life. So if you take a look at this here, one of the most recent studies looked at how many adults are survivors of substance-related loss or who has lost someone to a substance-related cause. And you see here it says 42%. So for every 2 people that you're meeting, I just want to acknowledge that hidden in the layers of their human experience are a range of challenges that you may never see. And this is often maintained because of the widespread damage caused by stigma. If you could advance, please. This is also a pretty infamous graphic that has been around for quite a while, and this really illustrates more of the narrowly the toxicological perspective related to opioids and the evolution of the opioid crisis. So the first wave you see is the rise in prescription opioid deaths. The second wave that you'll see in 2010 there is an increase in heroin-related deaths. And then in 2013, we started to see the rise in synthetic-related deaths, such as fentanyl. And it is well established among the scientific community that we are well into the 4th wave of this crisis, which is heavily characterized by polysubstance use, particularly fentanyl and stimulants. Next slide, please. So as you've maybe observed on the left side of the screen, we have just kind of a road that is cutting through all of these slides. And that was intentionally to get to this cross section here, as if, we haven't already established how increasingly complex the opioid crisis is, then we also layer in the complexity around housing affordability and availability. And here, what I really want to bring our attention to is really talking about rent burden. So the definition of rent burden is defined as a household spending more than 30% of their income on gross rent. And this is a common indicator that's used to measure housing affordability. And so you'll see here, specific to Waukesha County, 43.4% of renter households were considered rent burden in 2021, which was notably higher than the rates in the other suburban counties in the area and statewide. So noting both the opioid crisis and the housing crisis that we're facing, the strategies that we had developed as an action team, if you could advance, please, Jamie, we're primarily focused on deepening locally available research to begin to understand some of those features that we could strategically target for impact and change. And this is where it all gets really exciting. As someone who has been able to work alongside many partners in a way that has been really collaborative and innovative, our multidisciplinary team came together and we decided we wanted to understand the available and accessible housing options through a comprehensive asset map. And then if you look at strategies 2 through 4, these are really all sort of clustered together in a way that we were looking to deepen our research and understanding. And so we were looking at this important intersection through key informant interviews, partnering with a research institution, and building an interactive game design. I'm really excited for you all to hear from Jamie and Haley, who are going to highlight those pieces. And all of what we were doing here, our sort of underlying intention with this interactive game that we're designing is the purpose here is to have professionals be able to step into the challenges that people in our community face every day at the intersection of housing and substance use. If you could please advance, Jamie, thank you. None of this could have been done without our compassionate and driven interdisciplinary team. Everybody who came to this has been attending routinely and helping us push this forward, and really helping adapt something locally that may never have been done before. And so their support has been incredible. We've had hospital partners, we've had housing partners, Impact 211, direct service providers, and this has also created a very robust lens from which we can operate and better understand the needs of our community. Next slide, please. So why do we need each other? These mutually beneficial partnerships, and this was really the focus of another presentation that we have done, is that we could not have done this without each other. Specific to Haley and Jamie, they're able to offer tools, support, and resources that might not otherwise be available. And specific to Haley, who is going to represent here today, Medical College, she was able to really help us turn a hypothetical project into applied research and data analysis, like really providing a tangible blueprint to impact and affect future public health practice and advocacy. And so I am very excited now to introduce you to Haley to share her findings.
Hi, thank you, Steph. As Stephanie mentioned, my name is Haley, and I'll be talking about the academic side of the partnership, as well as the research that helps inform the education module that Jamie is going to talk about. So in my day job, again, I'll go quick because I want to save that time for Jamie. I serve as a community outreach manager for Aurora Healthcare. I've been in that role for 9 years now, and I oversee local charitable giving and community investment, our community health strategy, and community benefit reporting. So a whole lot of community there. I am also in my 3rd year as a student at MCW in their Master of Public Health program. And in January 2025, I began my field placement with the Waukesha County Public Health Department as an intern. So as we advance to the next slide, I'm going to talk a little bit about why we need each other from the academic side. So as you heard Steph mention, the Public Health Department and MCW each bring unique perspectives and strengths to the partnership. By working together, we embraced a mutually beneficial collaboration that strengthened data collection and analysis, our public health practice, and open collaborative spaces. So from the academic side, public health provides benefits that are not readily available in the classroom setting. So for example, public health provided students with on-the-ground professional training experiences that put theory into practice. So we spend years training and studying public health theory, and this public-private partnership provided an opportunity to gain real on-the-ground training that helps bridge education to practice. And then on the other side, local public health departments also empower students to connect with and serve communities directly. They provided an opportunity to directly connect with community members and stakeholders, as you'll see in a moment, and they truly understand the unique needs of their constituents. And this allows academia to build research and programs that are tailored and cultivate community-based participation. Because of this partnership, we were able to identify that gap in data that Steph briefly mentioned. Through the housing subgroup, we conducted research and we're using it to inform future work. So on the next slide, you're going to see a little bit about the project timeline. I am not going to run through it. What I want to make known on this slide, and again, this is kind of in reference to our previous presentation, but is to really focus on the fact that our partnership started long before the contract was signed in January 2025. We began talks back in September 2024 after the housing subgroup identified their need for more data, and we started dreaming up what a partnership could look like for both organizations. So for those on the call that are interested in working with an academic institution, the point of this slide is to really bring home that you should start planning ahead and begin those talks with those institutions well before you need that gap for additional resources filled. So on the next slide, I'm going to walk you through the research real briefly. I worked intentionally with the housing subgroup to determine the research question by narrowing down the data gap and the group identified. And we settled here with what systemic and service level gaps and nuances do professionals observe in supporting people who use substances and experience chronic homelessness? So there's that intersection that Steph talked about. So we did key informant interviews, and typically they're really focused on community leaders and stakeholders who often speak to system level issues for good reason. However, this group was specific in targeting direct service providers to really understand the nuances that exist in serving their clients and patrons. So we talked to first responders, direct service providers, healthcare professionals, social workers, and housing navigators. Phase 1 was all about defining the research question and methodology. Phase 2 was recruiting participants and conducting the interviews. And then phase 3 was the data analysis and determining the final results. So on the next slide, I'm going to tell you a little bit about what that data analysis looked like. There's a lot of words on this slide. I'm not going to read through them all, but we want to give you some context about how we got where we are and where we're going with it. So with the results from the key informant interview, I took all of the transcripts through a thematic coding process, which is just a really big academic way of saying we looked for themes and commonalities among each of the transcripts. So level 1, which is there in the orange, is often referred to as open coding. I identified 140 unique codes or labels that help participants sum up a thought, sentence, or a point. So we started big and we're going to start narrowing down. Level 2, also called axial coding, that is where the codes are sorted and grouped into sections. So you can see 7 groups were identified in this phase there in the green. And then each section had between 2 and 6 clustered. So we grouped them and then we grouped them again even smaller. For example, under policy impact, clusters included policy design and implementation, systemic barriers, and client vulnerabilities. The final level, which is the selective or thematic coding there in the blue, level 3, is where our 4 overarching themes were identified, and that is support for professionals, harm reduction and housing first education, landlord engagement, and balance of power. A really quick note on research limitations. I'm not going to run through it all because of our time, but just know that there are limitations to this research, primarily me being a singular researcher. Obviously, in higher level evaluations, we would want more people at the table discussing bias and interpretation of the results. The other piece is because it was a singular researcher, we had a relatively small informant pool, but special attention was paid to avoid confirmation bias. Because affordable housing and substance use is a well-known issue within Waukesha County, that is why we spent so much time upfront on the methodology, preemptively discussing confirmation bias and interpretation. And then also, subjectivity is always at the forefront when you're doing interviews like this and you're asking people to recall their experiences. So we were very upfront about potential for bias and we tried to mitigate that where we could. And then my next slide just pulls out one quote, and I am going to read it and I'll be quick, but I think it's important for this group to hear it. So this is what one participant said, quote, "We need to invest in meeting the moment in 2025 and rebuilding systems with people who have lived experience at the center. I think when communities face turmoil and we are in deeply troubling, problematic times, It is then that communities start to band together and find strength in one another. And I read that to say this: all of the things that have happened up to this point in the community has brought us closer to this opportunity. You saw the 3 opioid waves that Steph discussed, the overdose crisis announcement in 2022 prompting OFR, the CHIP team embracing a difficult intersection of substance use and housing that needed attention. So we faced questions and hesitancies by really well-intentioned people who understand how complex this intersection is. And so we were realistic about it. We know we cannot solve the system ourselves, but we can start working on foundational actions that help move community health forward. So that's what we did. On the next slide, we looked at those 4 themes together as a housing subgroup, and then we chose 2 that stood out, and that was support for professionals. That's where the education piece comes in, and then harm reduction, because we know that's essential to meeting and serving community members and clients where they were at. So I am going to breeze through this last slide because I want to leave Jamie a solid 10 minutes to talk about what the module is going to look like. But essentially, once we had the final results, I was then able to start diving further into learning theory and the research surrounding it. And we landed on transformative learning theory. This is a theory that was developed by Jack Mesereau in the 1970s. It is specifically an adult learning theory focused on change through critical thinking. So it starts with providing learners with a disorienting dilemma. So that's kind of this game that you're going to see. And that helps prompt self-examination of personal beliefs and assumptions. And so by using techniques like case review, mock role play, which is what this is, and debrief, all of these are also learning activities that are embraced by the health industry or health professionals. Learners are guided through the critical assessment of their assumptions to help build a new worldview and acquire new skills, essentially harm reduction, acceptance, and uptake. So there are 4 areas that are central to transformative learning theory. I'm going to touch on them very briefly. Facilitation and learning environment. It's really crucial to have leadership support as we embrace or as we went on this journey, and to balance the power between the facilitator or expert and learner. Because we're placing learners in a vulnerable position through simulation, we need to ensure that they are in a comfortable and safe environment. And the next one I'm going to talk about, I'm going to skip a little bit. The next I'm going to talk about is the learning and the experiential simulation. That's 2 and 3 there. They really go together. And that's the mock role play through simulation that Jamie is going to talk about. This really helps players learn to adapt in an unfamiliar situation and think differently about things gone wrong. And that's where critical self-reflection really starts to weave its way through and start with perspective, growth, and transformation. And then finally, on the 4th piece, which will be down the line, is about evaluation. Transformative learning theory really benefits from what we call a mixed methods evaluation. So we look at both quantitative, which is like the hard and fast descriptive numbers, but we also look at the qualitative, which is the research I did, and beyond. Because we're talking about personal growth and transformation, it's hard to narrow it down to I agree with this statement, somewhat, likely, not at all. And so it really takes talking with groups in interviews, doing case studies or focus groups to be able to understand what personal transformation looks like. I could talk about transformative learning theory all day, but I am going to take a moment now to take a breath and then pass it over to Jamie, who is going to walk you through the product design.
All right. Thank you. And amazing work, Steph and Haley. As I said before, my name is Jamie Penza, and I'm a co-lead for this CHIP team. I work as an emergency preparedness planner for Waukesha County Health and Human Services in the Public Health Division. And I'm also not going to go through my resume, but you can skim through this slide if you're interested. I have a background in education and public health. I'm not a subject matter expert in substance use or housing, and I don't interact with clients or service providers on a regular basis, but I do have a unique skill set that I brought to this group as well. With a strong background in public health, education, injury prevention, coalition building, and group facilitation, I was able to help with some of the organizational pieces for our group, and I asked a lot of clarifying questions. I helped to synthesize the research and expertise into a tangible product that we could share with others. And because of my work in emergency preparedness, I was able to leverage some of my unique professional partnerships and provided an outside perspective to our subject matter experts. But most importantly to this project, I had access to some pretty cool technology that we're using to build an interactive simulation and learning module. So when our CHIP team was talking about what we wanted to do and how we wanted folks to experience what it might be like to be at that intersection of substance use and housing, to be able to really walk in their shoes, I was reminded of a conference session that I attended at the NACHO, which is the National Association of City and County Health Officials Conference in 2023. Minnesota Department of Health had a presentation that they did in collaboration with the School of Public Health in Minnesota. They presented a session on some immersive learning games that they had created to teach people about what it's like to be a disease investigator or what it's like to be an incident commander during a devastating tornado that wiped out several community lifelines. These games allowed you to become the character, and then you would navigate through different scenarios, making choices and learning along the way. If you look at this map, you can see the incredible reach and impact that the games have had nationwide, and they're still continuing to grow. This is a slide from 2023, so I'm sure it's been even more utilized since then. But the darker the blue, the bigger the reach. And the numbers are tiny and it's hard to tell. But remember that this started in Minnesota. And look at how much the dark blue has reached Texas, California, and all across the country. So I was thinking, hey, if they did that with this, think of what we could do if we built something similar for substance use and housing folks. I have a license for the same software that they used, and I suggested to the group that we try it. I'd never done anything like this before. Like I said, I had the license, but I never even opened the program. But I figured if they could do it, we could do it, right? How hard can it be? So the first step was deciding on the audience, the objectives, and the data that we wanted to include in our simulation game. We had a meeting and we put these giant Post-it notes on the walls. We talked through all the data and research that Haley and Steph shared with you, and all of our partners in the room are from different agencies and different lines of work, and they had ideas and stories to share. So we went around the room, and you can see the squares on this slide represent the giant Post-it notes that we had put up on the wall. And we started gathering ideas, and we were drawing on the whiteboard and mapping out what the simulation could look like. It started to get really complex. And at one point, it was so hard to keep track of all the ideas that instead I developed a shared spreadsheet so that our subject matter experts could fill in the data and reference sources that relate to each interaction that you would have in the game, so that everything that we're building is backed by data and real world experiences. So this is what it kind of looks like. When you start out, you start with something which is called the game of impossible choices. As we were starting to develop this, we were like, what do we want to happen? And we said, well, we want people to know what it feels like. And some of these people do face impossible choices. And so that was it. We knew that we had our title. So Game of Impossible Choices is where the player chooses a character, and every choice that they face doesn't work out. So we do have a disclaimer that we're building in that this is not everyone's story, but it could be someone's story. And there'll be a link to all the data sources on the bottom of the slide so they can see where this comes from if they want. And there's also a skip button if somebody needs to just advance directly to the modules. After experiencing this discouraging scenario, players are going to learn about prevention measures or programs that can be implemented to improve the outcome. So once the learning is complete, then they're going to come back and play the exact same again, the same game again, but now instead of a game of impossible choices, it will be a game of what if. What if we implemented these changes into our fields? It's still not going to be everyone's story, but it could be someone's story. And our hope is that the journey leaves the player feeling hopeful, encouraged, supported, and empowered by the resource and data that we use to design this. So looking at this example on this slide, we've got a person in this case that was prescribed medication that increases their chance of a job-related injury. This could be anyone. This could be a worker. This could be any field. No matter who you are, you have two choices. You're either going to take the medication or you're not going to take the medication. If you decide to take the medication as prescribed, or you decide not to take the medication as prescribed, when you're playing Game of Impossible Choices, it doesn't matter. You're severely injured at work. Your emergency room blood tests reveal medication in your system that warn against operating machinery. The person in this image is concerned because he knows that this is going to negatively impact his job. After you learn, and so some of the modules will teach different lessons, and it's going to relate to these slides. One of them could be workplace-friendly recovery support policies. And so after learning about that, when they go back and they see this same scenario again, you're going to see the same two choices. Knowing that last time it was disaster for you, this time, what if those policies were implemented? Again, you either take it or you don't. It doesn't matter what you choose. When this person makes their choice, they see that they're comfortable talking to their employer and learning about choices available. Openness around injury prevention and mental health is supported through recovery-friendly workplaces. So no matter what happens, they feel okay talking to their employer about it. And so that's kind of where this connects. And there's many, many scenarios that we are building based on the different folks that helped us to make the slides. We have a lot of different scenarios like this, but it's all going to be connected to the learning and help people to move from impossible choices to what if and hope. On the back end, if you look at this slide, this is what the storyline module looks like. Building the modules is much like building PowerPoint, but instead of going from one slide to the next, you can add new connections and branching paths and a bunch of different triggers like clicking on a button to advance to a new slide or to watch a video. You can have interactive rooms where you can click on things and it'll pop up different choices or information. So it's super interactive and fun. And it feels more like a video game when you're playing it than a boring learning module. So we're hoping for that impact and engagement. So because of the level of complexity and subject matter expertise that was required to build this project, it took a ton of collaboration and coordination. On the screen, I've listed our work group members that were involved, and I want to publicly thank them once again for their contributions to this initiative. We have more work to do behind the scenes to get everything finalized, so our expected launch date for the final version of the game is fall of 2026. But we hope that you will consider partnering with us. This is the part where we need your help. We need folks that are willing to pilot test the game once it's completed, and folks that are willing to share the final version with their networks and colleagues. So if you don't mind using the QR code on the screen or the link that is in the chat, we would like you to fill out this very, very brief survey, and everything's optional on there. So feel free to click on or answer whatever you're comfortable with. There's going to be an option for you to sign up to help us pilot test it, sign up to share it with colleagues when it's done, and also a spot for you to leave feedback about what you've heard today. If you have questions about the project or suggestions after hearing what we're up to, we would love your feedback. So thank you so much for considering partnering with us. I want to save a little bit of time to answer any questions that you have. So I think we have about 5 minutes left.
Yeah, no, you're great. You're great. Let's,
Okay.
do you mind, Jamie, just stopping screen sharing, and then that way we can see you and you can see everybody. or even maybe we don't spotlight. That might be a good idea too, Rachel, so then they can see everybody. So folks, questions that are coming to the surface. I have a couple of them, but what questions are coming to the surface for you, or what is something that is exciting to you? Either quick raise hand or just unmute.
To Jamie in the chat.
Yep, Jamie's saying this is stellar. Awesome. Awesome. Jamie Penza, the question that I had was who you mentioned that, you want folks to be able to distribute this to partners. Who do you envision using this game, and how might it change how they are doing their work?
Yeah, that's a great question. And I think it depends on just who do you think could benefit from this. So there's lots of different agencies, and I'm hoping that as people hear about it, they start thinking, I know somebody who would be really good at this, or this would be really good for. Originally, we were thinking service providers, people who work directly with clients, but that really could go across many different industries and many different levels. And maybe somebody at the top feels like, well, if we share this with our program manager, they could share this more widely. Or somebody might say, I work with a couple nurses who would think this is fun, or the people who work in my shelter would really benefit this. So really the sky's the limit to the imagination of the people who are willing to partner with us.
I wonder too if families, friends of loved ones who are struggling with substance use disorder might find value in this as well. We're going to hear about a training in a couple of minutes, and that was one of the things that I thought of. How about others? Where else do you see that think that this might be valuable for use in our community? Either pop in chat or unmute. Unmuting would be great.
Yeah, we welcome positive or constructive feedback. When we started this out, we didn't have the game of what if. It was just the impossible choices. And when we presented it to our core team after that, coming up with the game, they said, hey, this is great, but we're going to need a piece of hope. And so that's when we added the game of what if. We were like, oh, of course, that makes perfect sense. Yeah, so we have more work to do.
That's the other side. Yeah, great.
So
Jamie says if we can get this into the hands and minds of local and state decision makers, it would be awesome. That is a great, thank you, Jamie. How about others?
Yeah.
Other ideas?
And Jamie, I do have some connections with some different work groups because of my preparedness work, and I hope to share it on a higher level. And I told Steph and Haley that we should take this out to conferences and try and do what Minnesota did with their preparedness ones, to share it out wider, and hopefully we can impact many people in many different communities across the country.
Fantastic. Roadshow for sure. And Dr. Krasovich says this looks great. I would think peer support folks might benefit and would be interested in looking at it for some of our resident physicians. Awesome. Yeah. SCAOTA, Felicia says, connect to the SCAOTA and the State Mental Health and SUD Recovery Conference. That's excellent. Excellent. Okay. Any other ideas? Keep popping them right into the chat. We were going to pop into breakout rooms, but I think I'm going to toss my breakout room question into the chat to see if you can respond to that while Megan and Heidi are kind of getting ready for their presentation. So the question that I was going to have in our breakout room is this: where do you see opportunities to strengthen or expand partnerships in your own work or collectively related to housing and substance use? So kind of ponder on that for a minute while you take just a quick breath and a stretch here while Megan and Heidi get ready for their presentation. Haley and Steph and Jamie, so grateful to have you present. Keep us posted. When you're ready for updates, let us know so we can put you back on the agenda. Really appreciate it.
Thanks for having us.
Great, fantastic. All right, fantastic. We've got a few things popping into the chat. At this point, I am really excited to introduce Heidi Begovitz and Megan Ballard. Heidi and Megan had the opportunity they received a grant from the Alliance for Wisconsin Youth, and they traveled to Washington, D.C. to participate in the Addiction Policy Forum training. And they came back with this wonderful training. About 20 of us participated in it about 2 weeks ago. And that was just kind of a soft launch. We wanted to see what it was all about. And in that room, we had law enforcement, healthcare, peer specialists. We had a whole bunch of different people that had an opportunity to have an opportunity to kind of feel what this training looks like and how we might use it. And we thought it would be really great for them to bring it to you, not the training. They're just going to tell you a little bit about the training and how you can get access to the training. But I also want to put a caveat on it where our CHIP harm reduction team is also looking at, not necessarily, they can't change this evidence-based training, but they may add some harm reduction education as a kind of a PS, a postscript to the training. So that's still work in progress. But I'd like to pass it off to Heidi and Megan, who are going to tell you about the training and what their potential next steps might be.
All right. Thanks so much, Terry. So I'm Megan. I'm the case manager for the City of Waukesha Fire Department. We, under a new concept, mobile integrated health, and I just have been telling everybody that we started grant-based for my position and worked really hard the last few years and fully funded through our own funds as a fire department, first in this state to have a social worker. All right, so the Addiction Policy Forum, we were able to go, that was in early October. Heidi and I went. So the program or the training that we have, there's different, I guess, there's like an 8-hour one, and then there's a 3-hour, 2-hour, and then there's a one that they just put out that's 45 minutes, which is awesome. So this program was created by the Addiction Policy Forum, which is a national nonprofit that is working to end addiction as a major health concern. The Addiction Policy Forum was created by families impacted by the disease. It was founded in 2015, and they are working in states and communities across the country to end stigma, help patients and families in crisis, and translate the science around addiction. Their strategic priorities include helping patients and families in crisis, ending stigma around addiction, expanding prevention and early intervention, increasing the uptake of evidence-based practice, and advancing research. And to note, Heidi and I got trained to be trainers for this training. Okay, say that 5 times fast. So today we're going to be talking about Encompass. This is the 8-hour training. So it's a comprehensive training on navigating addiction that aims to increase addiction knowledge and just decrease stigma around addiction. The Encompass training is a resource for family members who are trying to navigate the complex world of addiction and help loved ones achieve recovery. The training includes in-depth information about substance use disorders, treatment options, communication strategy, and self-care tips. This training aims to provide practical content to help the attendee understand prevention, early intervention, and treatment of substance use disorders, as well as how to engage someone struggling with addiction and develop an action plan. Attendees will learn the latest science and research about addiction, signs and symptoms of addiction, assessment and treatment options, including medications to treat, how to access recovery supports, how to start the conversation, and how to set healthy boundaries. In 2021, the Encompass program was launched across Ohio with the help of Governor DeWine's Recovery Ohio office. 22 Encompass trainings were offered to community members throughout 22 Ohio counties that had high numbers of overdose deaths. Attendees were provided a pre and post survey to complete that measured addiction knowledge, confidence, and how to respond to a substance use disorder, and levels of stigma, including stereotypes, prejudice, and discrimination. A total of 492 individuals completed the pre and post survey. After reviewing the data, it was found that attendees' addiction knowledge increased overall after attending the training. Attendees displayed improved knowledge of overall substance use disorder knowledge as well as around medication for addiction treatment.
Alrighty. My name is Heidi Begovatz, and I am a case manager with the Rogers Opioid Outpatient Program, known as Worth It. And I'm going to be talking about the Responding to Addiction training. This is the other training that we went and learned about. So this training can be done in either 3 hours, 2 hours, or the new 45-minute component. It has a couple different lengths depending on the individuals, how long they want to sit for or how long time they have available. The new 45-minute version just came out a couple weeks ago, and we're really excited to be able to talk about that and offer that to the community members. As we know, a lot of folks have a little bit more limited time, and we can engage folks for a shorter period of time. So the Responding to Addiction training is designed to increase knowledge about addiction and really develop skills and strategies in the community. This one is really focused on learning the science of addiction and the signs and symptoms behind addiction, as well as looking at evidence-based treatment options, medication to treat addiction, and engagement strategies. It really focuses on teaching the idea of addiction as a brain disease and really focusing on shifting it from looking at a lot of that idea of addiction is struggling as a moral failing to more of addiction as a chronic health condition. And how do we treat a chronic health condition and looking at addiction from that point of view, which is really helpful when we're looking at how do we defeat stigma, right? When we can treat people as looking at a health condition, which is what this training is really focusing on heavily. This training is really ideal for families, friends, and caregivers, members of clergy, first responders, employers, educators, healthcare providers, community-based service providers, and other community members. It is a really broad training and really open to anybody who might need it. And similar to the 8-hour training, this training also went through a case study, and they saw a significant decrease in stigma with this one. The 45-minute training has not gone through a case study. Like we said, it is new. And so they are working on getting through a case study and getting it all through the journal article yet. So hopefully we'll have that researched in the next couple of years. On top of the other 2, or I guess technically 3 trainings, we also brought back with us a whole score of materials. So we have a Ready Built social media campaign. This has posts and videos that can easily be shared online, and we can add other organizations and programs logos to them. We also have a Language Matters fast fact sheets, as well as additional lectures, videos, and research from APF as we need. And it's really nice because these materials are constantly being updated with the most accurate and up-to-date research material about addiction from APF. So our database is constantly being updated on an ongoing live. It's a live database that's shared, and we have monthly calls with them as well. So I guess we have time for questions now, as it's kind of the end of our brief overview.
Yeah, it's perfect. Rachel is dropping in the chat. She's going to drop your email addresses into the chat in a second. And I've also created a Google folder with the materials that you sent, Heidi. That's some of the one-pagers and information that you can look at to see who might benefit from this training. So other folks, questions for Heidi and Megan about the training? Or those of you who attended, what did you find interesting about the training? And you know what? Let's remove the spotlight again. I'm just so I can see people. I'm gonna take our spotlights off, you guys. There we go. Megan and Heidi, do you have specific plans for rolling anything out for next year or at this point, or anything that you would ask of us?
I mean, I planned, because I work very side by side with CREW, which is the crisis response unit for the city of Waukesha Police Department. So, and I know Anjali used to be their second shift worker before she became a supervisor for the county. But so I was going to, I've started to talk to them a little bit about it. So I'm probably going to give them the 45-minute version, which is a perfect amount of time.
Awesome. Awesome. I also received from Captain Casta a couple of names from WCTC, and I will pass that on to you and Megan as well. And then I know the harm reduction CHIP team is going to continue having conversations with you. Any other thoughts or ideas for this team and in terms of advancing this training and sharing this training out in the community? Other areas where they should be hitting?
I didn't have any suggestions, but I was in the midst of sending an email to Megan and Heidi to see if maybe both could come to Crisis's business meeting. It would have to be at the start of the year, perhaps. I'll send out some dates and we can probably figure this out. But to have them come talk to crisis staff, and perhaps that could be a training that our staff could go through, or see how we could maybe even connect other community partners, or, just family members of those who struggle with addictions. I think that would be really, really helpful. Sounds like an amazing training.
Awesome. Fantastic. Got a couple of comments in the chat. I'm going to start bottom up. Ashley, we put their information into the chat. So if you could reach out to Megan and Heidi directly, that would be awesome. That's the team that covers the emergency department at Pro Healthcare. And then Kevin, did you want to share your thoughts? Oh, here. Yeah, there you go.
There I am. Yeah, I was just the question that you posed for us to consider. I was just thinking the hardest aspect of that is everybody's compassionate and empathetic until you move this population close to their own home.
And this is the housing, the intersection of housing and substance use. That was okay, gotcha.
Correct.
Yep.
And we're struggling with the Hope Center here in Waukesha and the homelessness that have been driven out of their camps. They're much, much more visible now, which is really stirring up a lot of anger and animosity in the community from people who don't really understand. These people were here before, but now they're much more visible.
And Kevin, I can't help but wonder if something like that, the game might help build understanding.
Kevin, I love what you said. Oh, I love what you said about the community. And I wonder if like a business association, is there like a chamber of commerce would be a good place to allow them to have that in your shoes kind of an experience. Maybe we can promote it.
I can think of the Downtown Business Association in Waukesha might be a good person to reach out. The Rotary clubs also might be another place to start because that part of their charter is to help. They're helping all over the world. I'm sure they that would be a natural fit.
Yeah, I
And
think so
maybe the
too.
faith groups as well.
If you can, all of us, if you have connections for Jamie and Haley and well, all of them, Megan, Jamie, Haley, and Steph, make that warm connection for them. As a, that's where they can make that next step. So if you have a connection, make an introduction for them. That's something that we in the coalition can do. Susie.
Yeah, I'm sorry to be Debbie Downer, but I totally get what Kevin's talking about because I've been hearing a lot of it again very recently. And it's wonderful to have that game, but that's not even coming out until what, late 2026?
Yeah.
Is there something we can do as a community right away? It's a big problem and we just can't look away.
Yeah, and that's our timeline that we put in place to give ourselves some wiggle room because we were hoping to have it done by the partnership summit, but when we see how much impact potential it has, we didn't want to rush it to get it out there quickly. We wanted to be able to add in as much depth and meaning as possible. So hopefully it will come out before then, but that's our wiggle room timeline.
And Susie, to your point, it has to be a multi-pronged solution. It's not going to be just one thing. So it's more conversation for sure. For sure. One quick question, Colleen, I want to make sure add SW to the meeting, please. Is that for me or is that for Megan? And I just want to make sure I'm not missing anything.
That was for Ashley when she's setting up the training for the ED IDHS.
Perfect. I just want to make sure it wasn't me. Okay, fantastic. All right. Oh, yep. Go ahead, Kevin.
Just one thought I had. We dealt with this same problem in the past decades, considering disabled people, mentally ill people, and the developmentally disabled, people not wanting them in their neighborhoods. And we've done a good job, I think, in a much better job at educating the public that these are our community members. And so maybe we don't have to reinvent the wheel, but we have to use that same process maybe we went through with disabled Americans.
Kevin, thank you. And I'm going to invite too, we have a little water cooler time from 4 to 4:30. If you want to hang back and continue the conversation, that is a perfect place for that. So thank you for that. And thank you for the comments. We are heading towards the end of our meeting here. We're going to do just a couple of quick, brief action team updates. And what I really want to emphasize is how you can get involved. So you can always call me, email me, and I can make that connection for you. I am sharing my screen, right? Yep. Okay, great. Fantastic. I wanted to note that the recovery support team, our next meeting is on December 11th, and we're actually going to do a little bit of brainstorming there. We know that some of the data that comes out of the Voices survey will be helpful to us in the latter half of 26. So we're brainstorming for the first 6 months of 26 at that meeting and identifying some things that we can do. The stigma reduction team meets on Friday the 19th, December 19th. And I think Joy and Jamie are both here. Jamie, I wanted just to give you a minute to do a shout out for our LinkedIn page. So I'm going to just ask you to hop in if you don't mind. Rachel, I'm calling an audible here.
I'm all over it unless Joy wants to step in. But yeah, my name is Jamie Bauer, and I am one of the co-leads with Joy for our stigma reduction action team. And one of the projects that we are kind of constantly working on is our LinkedIn page that we had mentioned a little bit before in Terry's wonderful programming here today. And with that LinkedIn page, we have a social media calendar that I more or less manage and make sure that we have posts lined up and on the ready so that we're always getting new, fresh ideas, new content, trying to engage people in the community in our work. So that being said, we've had some awesome content all of 2025, but we're almost out of 2025. So I got to make a 2026 calendar and we're going to need ideas. So if you have any kind of idea that has really anything around support and inspiration for either those struggling with a substance use disorder or families and friends of someone who is, inspirational quotes, even just like a little nugget of an idea, we can expand on it. And you don't have to actually create any content itself. Like you don't have to make this like pretty post with images and the right font. Don't get, Lisa Kwiat going on fonts, let me tell you. No, I'm just kidding.
We have Lisa and Nicole taking care of that for sure.
Exactly. They are fabulous. And literally I can like do a Word document with 3 phrases and they turn it into this glorious thing. So it would be very minimal effort. And then all you would have to do is email me your idea. I will put my emails in the chat. So there is one on the screen. I have 2. Feel free to use either one. And yes, I would love to hear from you and any idea that you have for our 2026 calendar.
Wonderful. Thank you. And I also want to make a plug that we have been posting a lot of our partners' events and things that have happened too. So that has been, we're posting our action team events as well as some of the partner open houses, things like that. So you are part of the coalition and an active member. So we invite you to do that as well. And Debbie, I will make that connection for you. Thank you so much for your interest in the stigma reduction team. Jamie and Joy, if you're here, Debbie is looking for information. So if you don't mind reaching out to her, that would be awesome. Perfect. Thank you, Jamie Bauer. Appreciate that. And then the metrics and data team, you heard from Francis and Felicia, they are working hard on distributing all of the Voices Surveys data cards and getting that moving. So we'll keep you posted on that as well. Anything I'm missing? Anybody who's out there, am I missing anything? Anne Marie, I think I saw you come in. Is there anything else I'm missing? Because I think at this point, I am going to turn it over to John. John Kettler, I'm going to stop sharing here.
Great. Thank you, Terry. Hey, just wanted to give a quick share for the group of something coming up in 2026. The county is going to be offering a free ASAM 4 training for the community. I know not everybody on this meeting is familiar with ASAM. ASAM is the American Society of Addiction Medicine, and most treatment providers use the ASAM placement criteria. It's a standardized tool to help clients achieve the correct level of care using multidimensional analysis. So looking at the whole person, a holistic vision. So there are different levels of care from ASAM. Colloquially, those are like outpatient, IOP, PHP, halfway house, residential. Those are the colloquial terms, but to help us understand the different levels of care, right? Currently, there are 10 different levels of care according to ASAM. And here's the need. ASAM right now is in its 3rd edition, but has published the 4th edition of the model. So treatment providers, as well as insurance companies are going to need to be switching to that model. According to DHS 75, the agencies need to use ASAM or another tool approved by the state, and most will be using ASAM. So this affects many insurance providers who are now going to be requesting the ASAM information, as well as the treatment providers, making sure we get people to the right level of care. So here's the offer. Waukesha County is going to host a training for community partners, no cost. Our opioid settlement funds will help with this. There will be continuing education units for those attending from NADAC and possibly others. The vision for this is kind of a day and a half. The first day, a half day, would be foundations of the ASAM criteria. The vision for this is a little wider. This would be suitable for clinicians, peer support, probation, court staff, students, faculty, insurance, billing folks, coders, anyone who might be using the ASAM language, need to understand the ASAM language, or been involved with things that are hearing the ASAM language and want to understand what this is and how to interpret treatment. The second day, which would be a full day, and you would need to attend day one to attend day two, would be the deeper dive on implementation. That is targeted more for the clinicians, the students, the faculty who will be using the actual model and doing the actual multidimensional analysis. So, when we're currently looking at probably around the end of March, very close to our next community Heroin Task Force Community Partners meeting. So that's why I share this now. What to do, I guess, is to watch out for emails on this. We want to make this available. It will require a sign up, so a link will be coming out, and reach out to me with any questions, unless there are any questions now.
Awesome, John. Thank you. And we will be sure to use the email list to forward that information. Any questions for John at this point? All right. At this point, it is partner announcement time. Anything to share for the team? Things that are coming up? While you're pondering, I just want to express my gratitude to all of you for your amazing work this year. I cannot believe some of the neat things and just experiences we've had as a coalition. Thanks, Kevin. I think about the recovery picnic and the prom and just so many really impactful things that have happened this year. So thank you so much. No partner announcements? No?
Everybody's bugging me to do another prom, so stay tuned.
Stay tuned. Okay. Claude, you're instructing another peer recovery coach training in February. Anything else you want to add on that? How do we
Yeah, so I'll pop my email in
Perfect.
the chat. Usually we just dropped our price down for this from $550 to $400. What it is it's a 5-day training, 8 hours a day in February. And it gets somebody their peer recovery coach certificate. It's all virtual, so it's done through a Zoom meeting. But yeah, it's just anybody who's interested in becoming a peer recovery coach, you can send them my way and we can talk about like what the course covers, if it's a good fit for them. And then, yeah, this is the first time we're doing it at that discounted price. So I wanted to make sure that I let you guys know about that. I can get the exact dates too and put them in chat. But if anybody wants, I could also send out a flyer. Terry, would you be the best person to send that to?
Yeah, absolutely. Because I'll be doing a meeting recap. I can include it in that.
Is this the
Okay,
CCAR
then I'll
training?
send out. I'm sorry?
Is this the CCAR training?
Nope, CCAR does their own training. Ours is still recognized by the state. But it is the WISHOPE curriculum through Layton Academy.
So Claude, one question Veronica's asking is, do you have to be a Waukesha County resident for the peer support training?
No, you do not.
Okay, there we go. Great. Good question, Veronica. Any other questions, partner announcements? I'm going to share my screen and invite Brenda to take us home.
What a great meeting. Thank you, everybody, for your participation. There was some great discussion. You will get a meeting summary in the next 7 to 10 days, so watch for that and share the important information. Our 26 meeting calendar is out, and we like the format of the 2 virtual and the 2 in person. We hope you agree that during the winter, colder months when maybe people aren't as excited to travel, we will be virtual on March 24th and December 1st. And we will have our super fun, robust, engaging in-person meetings June 9th and October 6th. We also are going to be sharing our end of the year survey. We did that last year. Got a lot of really good feedback and information from it. It helps to inform the direction in which we head in. So please take a minute when you do get that to complete that. Your input is really valuable and important. And then, as Terry said, we're going to have a water cooler conversation. As you know, with these meetings, the one thing we lose when we're virtual is that really important before and after meeting we all have with somebody we haven't seen in a while, our ability to connect and chat, which we try to build in, but this also creates a space to do that. So please join us. Stick around if you can from 4 to 4:30 for our water cooler discussion. So great meeting, everyone. Thank you.
Thanks, Brenda. I do want to make one comment about the quarterly meetings. You will be getting a calendar invite for a hold from Trista Matheson from the county for all of those dates that Brenda just shared with you. So you'll have a hold on your calendar, but you do still need to register for the meetings because we have over 270 people. So I want you to have the hold on your calendar, but then I really want to know who's really coming. So, and that's when you get the Zoom invite and that sort of thing. So the hold is coming. I'm sure she'll get it out this week. But any questions on that or administrative stuff? If not, I think that is it for us today. We did it, 4 o'clock. Have a good day. Have a good holiday season. Thank you for all the hard work and everything that you do. Thanks for being here today. Rachel, my dear friend Rachel, thank you for tech supporting today. Oh, sorry, I didn't recognize you. Awesome. And Rachel, I got it from here. Thank you. I will see you virtually next week. All right, hanging back. Perfect. Wonderful. So are there any topics people want to chat about, and or if there's somebody you want to chat with, I can put you in a breakout room, or where do we want to go from here? This is your spot, your time.
Well, I don't know, Terry. All of these people are fabulous. Like, I want to be in a room with everybody.
I know. What's bubbling to the top of your mind at the end of that meeting?
For me?
Yeah.
I guess the top of my mind is just hoping that we were able to rekindle some LinkedIn page interest and hopefully some, post ideas. Always looking for that. And honestly, I am just stupid impressed with Jamie and staff. And oh my gosh, the name's on the tip of my tongue. Yes.
Haley.
And
Yeah.
Haley's work on that like interactive kind of games scenario. Like that is such a great idea. And Jamie Penz, that when I heard you talking and you were like explaining how, well, I saw that at a conference once. I have this random license I don't use. Damn it, like that is so you. I can so picture you in that meeting just being like, let's try this. I love it. I love it.
And you have that education brain, so you could see you were that you could put that link together. So that was really interesting.
Yeah, I wasn't sure, Jamie, if they were going to go with it with me when I said, I've never done this before, but how hard can it be? We got this. But they did. I'm glad they did.
It's a great team. That is a really, really great team. Hey, Jamie Bauer, I may have forgotten to forward you something because I've got some information, or maybe Megan and Heidi have social media, or maybe they didn't send it to me. Remember when they presented to the stigma team a week or so ago? Would you be so kind as to reach out to them and ask them for that material? Because I think we can pull from some of their social media, their stigma reduction social media posts that they got from Addiction Policy Forum.
Yeah, let me go ahead. I actually I downloaded and I'm going to send to Debbie our notes from our meeting last month to give her like a flavor of what our meetings are like. And so I will double check in there and make sure that I either have their contact information or that I can bug you for it.
Okay, sounds good. Sounds good. How about others? What was rising to the top of your mind after this meeting? Or anything you want to noodle
I
about?
was just encouraged by the volume of substantial programming happening out there. I mean, everything today was like monumental, and there was just like one after another. I was kind of blown away. I mean, it's all amazing. There's so much opportunity too to move forward with so much of this and roll it out into the community at the community level. So kudos to everyone on their presentations and more importantly on the work behind it.
Yeah, there's a lot of opportunities for engagement. I mean, in every one of those buckets for our folks to get engaged and to pass things on to their network. So when I do the follow-up, I have to make sure to emphasize that. I'm almost feeling like the follow-up is going to be, there's like going to be too much in the follow-up. So I've got to figure out a good way to position this. So
I share John's sentiment too, because I think it's been a little bit of a bumpy year funding wise in a lot of ways. And so I always worry about, addiction and mental health, but addiction in particular getting like kicked to the wayside. And it's just really nice to hear, when we have funding showing up and we have people still doing innovative things and growing. Like it doesn't feel like we're being fearful or stalling or anything. So that was kind of a relief for me today to see and hear.
So I'm wondering, and I will put on our agenda that I haven't put together yet, Brenda, for our meeting tomorrow, because I kind of forgot we have a steering committee meeting tomorrow. I went, oh crap, I haven't done that agenda. There's three things. One is I want you guys to review the survey. I want to reflect on today's meeting, but I wonder if we can talk about the funding that Kat was talking about. I wonder if we can apply for like scholarships to put people through peer support training or something like that. I mean, if there's something that we can, that was the first thing that came to my mind when Claude said it's $400 or whatever. I think that might be a barrier for some. And I wonder if we could promote that. I don't know.
I think there's some limitations to that funding, being an agency that applies for that pretty regularly.
Okay.
It might be, but we should look at it and see because they change it always a little bit every year. So we can take a look at that for sure. I'll talk to
It's very prevention based, so I wasn't sure. Yeah. Yeah. Okay. So you guys will have to noodle on that. I got pretty excited about that. So
I liked the way that the county exec popped in at the beginning and really just gave his support for all the work that's going on and just how proud he was of everything that we've done. I thought that was really nice.
yeah, I agree with you. I agree with you. Jamie, that's a really good idea. Like do the first hour and the second hour. I like that. Yeah. Oh, go ahead.
Go ahead.
No, you go, Christine.
Well, I just am kind of amazed and blown away by where we are today and where we were in 2013 in the progression. And I know we've had ups and downs and almost, railroaded ourselves, but it's mind-boggling the success and where we've come. And I ended up in a room with Heidi, the Govets, and Wayne. It took Wayne a little bit of time, Euclid, to get into our group.
Yeah, he got there though.
Yeah, he got there. And to Larry's credit of continually asking county board supervisors to attend these things, because understanding and education is so critical. And today was the most participation I have seen with our county board. And so we had the executive there, county board supervisors, and I'm just amazed because things are getting done. And I wish I knew now, today, that I didn't know back then and could have maybe made a bigger difference. So thank you all. You guys are amazing. Thank you.
Christine, I feel like we continue to grow. I mean, I know I didn't have this education 4 years ago. I know. Continue every day we do better, right? This is maybe a preview, but I do some work with the workforce development boards in WDA 1, 2, and 3. So all of the Milwaukee region, Kenosha, Racine, Ozaukee, Waukesha, Washington County. So I'm helping them do some stuff. And I brought up that addiction training, and we're plugging that in. We're plugging that in as the 45-minute training as one of their offerings. And they're also going to do a mental health piece. They're going to do I might have said healthy aging, social connectedness. I might have been putting in some plugs. So I'm very excited. Megan and Heidi don't know this yet. I have to call them. So,
That's awesome.
Kevin, did you have something else to add? Oh, you're on. Oh, bye. Okay, thanks for being here.
Kevin, send me those candidate names that we talked about this morning.
They're trainers to train the trainer, right? So they should be.
No, they aren't training they are delivering the education. They are not trainers to
Their
train.
own. Oh, I thought that. Okay,
Yeah.
I must have misheard then. Okay.
Yeah, they are only to
train.
provide the training. Yeah.
Okay.
Yeah.
And that's that 45-minute one.
Yeah, so we took the 2-hour one. John was in there. Jamie, you were there, I think, right? Yeah. And it was really good, but Captain Casta said, I don't know if we can give 2 hours. Its time is really, but 45 minutes we could do. And then he gave me 2 names at WCTC that they're going to try to connect with, because if we can get some kind of training like that in a curriculum where folks who are in the law enforcement or first responder, then you're starting to make some systems change because they're hearing it right at the beginning. So, Joy, you said you really enjoyed the presentation from Steph, Haley, and Jamie. I'm curious if there's any potential for the game to be adapted with a youth focus. Jamie Penza.
I love that idea. And there is, absolutely. If we have experts who are willing to provide the data and background, I can add a third character. Right now, our characters that you can choose to play are a service provider or an employee. And so we can add a third one to be a child. We just need strategies and data that we want to implement for Hope. And then we can build those scenarios out to make that third character.
Love that. That is really, really interesting. I didn't even, wow. So when people, I'm struggling with my words here. Oh, I should stop recording. We don't need to record anymore.